Trust. When you think about medicine, it all comes down to trust, right? That faith we put in our doctors and our healthcare providers, but where does it actually come from? Well, it's built on a foundation of countless tests, a whole hidden world of assessment. And it all starts with something as fundamental as our ability to hear.
So let's get into it because this is a really interesting problem. I mean, think about it. You can't see sound, right? You can't see the tiny, incredible machinery in your ear that turns vibrations into something your brain understands. So how on earth do you test it? How do you take something so personal, so subjective, and turn it into hard data? Data that can literally change someone's life.
All right, let's start with something most of us can probably relate to, the classic hearing test. This is kind of the first layer of the story. You know the scene. You're sitting in a quiet little room, just waiting for a beep that you might not even hear.
Okay, so before you can test anything, you gotta know what you're looking for. And when it comes to hearing loss, it basically boils down to two main types. First, you've got conductive loss. Think of this as a plumbing problem. It's mechanical. Something is physically blocking the sound from getting where it needs to go. Then there's sensorineural loss. This is different. This is more like a wiring issue. The sound gets in just fine, but the delicate parts of the inner ear or the nerve itself can't process it correctly.
So the big question is, how do you tell those two apart? Well, one of the most classic and honestly most elegant tools is the Weber test. It's so simple, it's genius. An audiologist takes a specific 512 Hz tuning fork, and by the way, that frequency is the perfect sweet spot between a sound you can hear and a vibration you can feel. They strike it, place it right on the middle of your head, and the vibrations travel through your skull straight to both of your inner ears. Then they just ask you one simple thing: where is the sound the loudest?
Okay, get ready for this because this is the really cool part. The answer is totally the opposite of what you'd expect. If you have that plumbing problem, the conductive loss, like say from a bunch of earwax, the sound is actually louder in your so-called bad ear. How is that possible? Well, that blockage acts like an earplug to the outside world, trapping the vibrations from the tuning fork inside your head and making them seem louder. But if you have the wiring problem, the sensorineural loss, the sound is, as you'd expect, louder in your good, healthy ear. It's just a brilliant bit of diagnostic logic.
Of course, we've come a long way since then. Today, the gold standard is something called pure tone audiometry. This is the one you probably picture. You're in a soundproof booth, you've got headphones on, and your only job is to press a button every time you hear a beep. It seems simple, but what it's really doing is creating this incredibly detailed map of your hearing ability across all sorts of different frequencies.
But what happens when your patient can't press a button? What if they can't raise their hand? What if your patient is a newborn baby, just a few days old? How in the world do you test someone who can't even tell you what they're hearing? This, my friends, is where things get way more complex and way more ingenious.
Yeah, for babies, it's not just one test. They bring out a whole test battery. It's like a symphony of really advanced tools. Some of them can actually measure the tiny, tiny echo that a healthy inner ear makes when it hears a sound. And others, like the auditory brainstem response, or ABR, they actually measure the brain's electrical activity in response to sound. Think about that for a second. They are literally watching the brain listen.
And this right here just shows you the level of precision we're talking about. This isn't a simple, yes, they heard it, or no, they didn't. What you're looking at is the standard data for that ABR test. Audiologists have to compare a baby's brainwave response down to the millisecond against these incredibly specific charts for their exact age. I mean, just look at the detail for an infant at 39 to 40 weeks. It's absolutely mind-blowing. But here's what's so important to remember. All of this super technical, data-driven stuff, it's also deeply, deeply human. Because buried in the same official protocol with all those data tables, you find guidelines like these. It's a powerful reminder to the clinicians that behind all the brainwaves and charts, there's a family that might be about to get some life-changing news. So the protocol for the test is also a protocol for compassion. That's huge.
Okay, so we've seen how incredible the systems are for testing patients, right? From a simple tuning fork all the way up to complex brainwave analysis. But all of this, it naturally leads to a much bigger question.
We test the patients, but who tests the doctors? Who makes sure the person reading those charts, making the diagnosis, and having that tough conversation is actually qualified to do it?
All right, let's peel back another layer. We're now diving into the world of medical licensing exams. This is the high-stakes system that's designed to make sure every single doctor meets a really tough national standard.
In Australia, for example, a major player here is the Australian Medical Council, the AMC.
And really, their mission statement says it all. Their job is to protect the public by making sure doctors meet the standard. They're the gatekeepers.
And one of the biggest hurdles they set up is the clinical examination. Just try to imagine the pressure. You're a doctor. You're standing outside a door, a bell rings. You have 2 minutes, just 2, to read a complicated patient scenario. A second bell rings. You walk in, and now you have 8 minutes to interact with an actor playing that patient, all while an examiner sits in the corner, silently watching and grading everything you do. We're talking knowledge, communication, poise, just total grace under pressure.
And if you look at a sample mark sheet, wow, it shows you just how intense it is. It's so much more than did they get the diagnosis right. The examiner is scoring them on everything from their bedside manner and their empathy to how well they explain things in simple terms. Every single part of that conversation is under a microscope.
In the end, for each one of these little encounters, it all comes down to a single global rating from the examiner, and the stakes couldn't be higher. You need to get a passing grade on 10 out of 14 of these stations to get through. So it's not just a test of your textbook knowledge, it's a test of your real-world performance when the pressure is on.
So if you take a step back and look at the big picture, you start to see it. All these tests, whether they're for patients or for the doctors themselves, they're all part of this huge ecosystem. It's a whole system of safeguards, and it's not just about finding diseases. It's about building and protecting the trust that our entire healthcare system is built on.
And this idea of using tests as a safeguard, it goes way beyond the doctor's office. Think about really noisy workplaces. There are rules that say new employees have to get a baseline test to see what their hearing is like when they start. And then they get regular monitoring tests every couple of years to catch any problems early. See? It's the exact same principle. Test, monitor, and protect.
And for this system of trust to really work, it has to be fair. It has to be accessible. That's why right from the very start of a medical career, those big entrance exams like the MCAT have all these accommodations in place for people with disabilities. It's all about making sure the path to becoming a doctor is open to anyone with the talent and drive. And that, in the end, just makes the whole medical profession stronger.
So there you have it, from a simple vibrating tuning fork for one patient, all the way up to this massive national exam for future doctors. This whole hidden structure of testing is what holds up our trust in medicine. It's this constant system of checking, verifying, and protecting, which really just leaves us with one final question to think about. As medicine keeps getting more and more advanced, what's the next step in how we test for excellence?